Q&A 嘅按鈕，並輸入你嘅問題，志願者咧會將呢啲問題翻譯出嚟啦，然後咧將呢啲問題咧添加到我哋嘅問答列表嗰度，我哋會盡我哋嘅所能回答盡可能多嘅問題。口譯服務咧可以喺 Zoom 平台嗰度獲取到。使用 Zoom 平台參加我哋嘅會議咧，請喺你嘅瀏覽器入邊輸入呢個連結，即係屏幕上方所顯示嘅連結就可以啦。多謝 ，Thank you。
Para sa mga nais makakuha ng interpretasyon sa wikang Pilipino, pakipili lamang po ang iyong wika sa ilalim ng nakikitang globe sa inyong Zoom screen. Kung kayo naman ay may katanungan, pakipili po ang Q&A button na nasa ilalim ng inyong Zoom at piliin ang uri ng iyong tanong. Idadagdag namin ang inyong mga tanong sa pamamagitan ng aming volunteer at gagawin namin ang lahat na makakaya para masagutan po lahat ng mga katanungan. Sa Zoom lamang makakakuha ng serbisyong pangwika at kung nais po ninyong sumali sa Zoom, ilagay lamang ang sumusunod na link sa inyong browser. Thank you.
يرجى من الأفراد الذين يحتاجون إلى خدمات الترجمة الفورية باللغة العربية اختيار الزر في أسفل شاشة الزوم الخاصة بهم كما هو موضح في الشريحة. إذا أردت أن تطرح سؤال، الرجاء اختيار زر السؤال والجواب Q&A في زوم واكتب سؤالك. سيقوم المتطوعون بترجمته وإضافته إلى اللائحة. سوف نبذل قصارى جهدنا للإجابة على أكبر عدد ممكن من الأسئلة. شكرا.
Những người cần dịch vụ thông dịch bằng tiếng Việt, xin vui lòng chọn nút ở cuối màn hình thu phóng của bạn như trong slide này. Nếu bạn muốn đặt câu hỏi, vui lòng chọn nút câu hỏi và trả lời trong thu phóng và nhập câu hỏi của bạn. Các tình nguyện viên sẽ dịch và thêm nó vào danh sách. Chúng tôi sẽ cố gắng hết sức để trả lời càng nhiều câu hỏi càng tốt. Phiên dịch chỉ có sẵn trên Zoom. Để tham gia qua Zoom, hãy nhập liên kết sau vào trình duyệt của bạn. Cảm ơn rất nhiều.
Good evening. Welcome. My name is Hayin Kimner. I'm one of your moderators tonight. I'm the Interim Executive Director of Parents for Public Schools. And as many of you may already know, PPS works to strengthen the processes, systems, and practices of engagement and partnership to ensure meaningful and equitable opportunities for students, caregivers, and families. Tonight, we're joined by several other co-hosts, the 2nd District PTA, the Mission Economic Development Agency and graduates, the San Francisco Department of Public Health, and the Department of Children, Youth, and their Families. Thank you to our partners. This event is also being streamed live through the SFGovTV YouTube channel and Facebook page. There's a maximum capacity in this Zoom meeting of 1,000. So if there are others that you know that are trying to get in but aren't able to, please send them to those sites where we will have volunteers monitoring comments and forwarding any questions they see to our panelists here in the Zoom meeting. There will also be places where you can find a recording of this event after it is over. Katie?
All right, thank you. So my name is Katie Tang, and I am the Public and Governmental Affairs Director at Department of Public Health. I am your other moderator tonight. We are so glad to have you all join us today for a town hall for San Francisco families and caregivers to provide information and answer questions about how the Department of Public Health and our San Francisco Unified School District work together, how and why health and safety decisions are made related to school reopenings, and what before and after school program options are available for families through the end of this school year. Again, if you need simultaneous interpretation, please select your preferred language through Zoom at the bottom of your screen. This feature is available through computer audio only, not by calling in over the phone. You may want to choose the option to mute original audio if you don't want to hear the English language while you're listening to the interpretation. And we'll also have recordings available in language after the meeting is over. We want to also remind panelists not to speak too quickly, and I'll try to do the same, so that our interpreters can keep up. So thank you all. we'll be taking audience questions through the Q&A buttons, as well as through SFGovTV Facebook and YouTube live stream pages. We won't be using the chat function. So first, I'd like to introduce our panelists for the evening. Would like to ask if each of you can introduce yourself and your role, how it's related to school reopenings. And so I'd like to start with Dr. Susan Phillip.
Good evening, and thank you so much to the organizers and for everyone who has made this evening possible. I know it's a tremendous amount of work, and it is a tremendous opportunity. I'm so happy to be able to join you, and thank you for taking time out of your busy schedules and your evening to be here. My name is Dr. Susan Phillip. I am the acting health officer for the city and county of San Francisco. I'm an adult infectious disease doctor by training, and I'm so pleased to be with you this evening. Thank you.
Great. Next, we have Anna Velidzik from our Department of Public Health.
Hello, everybody. My name is Anna Velidzik. I work at the health department, and my role is to work with the San Francisco Unified School District in approving the school application process. I'm very honored to be here. Thank you.
Thank you, Anna. Next, we have Maria Sue from our Department of Children, Youth, and Families.
Good evening, everyone. My name is Maria Sue. I am the director for the Department of Children, Youth, and their Families. Our department is the department that administers the Children and Youth Fund, which is a voter-approved source of income that comes into the city based on property tax revenue. We are deeply committed to advancing equity and healing trauma. We bring together government agencies like other city departments, as well as work very closely with our school district and nonprofit agencies to strengthen our communities, including, of course, our families and our children, to ensure that they all live lives full of opportunity and prosperity. DCYF's role in this work right now is working very closely with the Department of Public Health and our school district to ensure that there are opportunities such as after-school programming, particularly in our Community Hubs initiative, as well as summer programming. I look forward to having this conversation, and I look forward to answering any of your questions. Thank you.
Thank you. And next we have Bailey Lau Smith from the San Francisco Unified School District.
Hello and good evening. I'm happy to be here. My name is Mele Lau Smith, and as Ms. Kim said, I'm with the San Francisco Unified School District. And I have many roles, but in particular, I have been part of the group that has been working on our COVID health and safety protocols for reopening schools, as well as with many of other colleagues that will be able to answer. I will be able to answer some of the questions from them this evening. I'm happy to be here.
Thank you very much. And so before our panelists begin answering your questions, we wanted to share some basic information. And so Dr. Phillip, would you mind by beginning to talk about your role in terms of guiding the community through the pandemic and where San Francisco is right now in the pandemic response with a specific focus on schools, and also how decisions are made at the Department of Public Health related to the State Department of Public Health and the CDC. Dr. Phillip?
Thank you so much, Katie. And thank you to my colleague, Anna, who will bring up the slides. Great. And again, thank you. It is such a pleasure to be here with you all this evening. Next slide, please. I wanted to start by talking through the role of the local health officer, the position that I am in now as the acting health officer for San Francisco, and to explain a bit about how my role and the role of the Department of Public Health fits into the role of schools and our collective work together with you all, with teachers, with staff, and with people throughout the city to work to reopen schools. So first of all, every county in California is required by state law to have a local health officer, and that includes San Francisco. The health officer is an agent of the state of California and has powers, legal powers to create health orders, which are legal binding documents and laws as a result of those functions from the state. So this leadership and authority is given to protect and promote the health of everyone in the county in which they serve. The position must be a licensed physician. It is appointed by the County Board of Supervisors. It directs public health services, again, with the goal of protecting and promoting health. And the position has very broad health protection powers and abilities, especially in regard to communicable diseases and immediate public health hazards that could harm health. But there are limits to what this position can do. So for instance, I in my position am not able to create a health order that automatically reopens schools. Instead, we are able to create the orders that set the conditions under which schools can operate safely using the best science and knowledge that we have. We set those parameters in conjunction with our state and national colleagues and experts, and in collaboration with many groups across the city, and certainly with our partners at the school district. People wonder where the United States Centers for Disease Control, or CDC, fits in. This is our federal top public health agency in the United States. They release guidance about how schools, for instance, can operate safely, but they do not create laws that individuals and counties and states must follow for the most part. However, state public health departments can create legal structures, and we've seen that in our state's blueprint for a safer economy. And then the county has the ability within the state's framework to be more health protective, to be more restrictive if it is deemed necessary by the health officer, but we cannot be looser than what the state allows. So there are lots of constraints, lots of considerations when we are thinking about the role of the health officer, in particular in relation to schools. Next slide, please. So I talked a little bit about this, but to lay out a little further how decisions are made for safer school reopening in San Francisco, we all are responding to and reading the guidance that comes out of the United States CDC. Their experts often help set the standards for how we can operate safely, and that has been true throughout the pandemic. But California also has experts, and they have created a blueprint for a safer economy. And they have said that in the orange tier, where San Francisco is currently, schools with TK through 12 grades can open with COVID-19 health and safety measures in place. So that is what the state allows at the orange tier where we are. So we then, in the San Francisco Department of Public Health, in collaboration with our colleagues in the city attorney's office, create the legal documents, the health order, and the school's directive that allows the schools to open once they have successfully completed an application process that outlines the necessary health and safety standards. And what we're all going to do collectively to ensure that students, teachers, staff, families are all able to stay as safe as possible during this pandemic and still be in school. Our COVID-19 command center at the city has been activated during this pandemic to respond to all sorts of needs of the city, and schools have been a particular priority. And during the process of meeting the panel, I know you saw my colleague, Anna Validzik, and she has been leading, along with other colleagues, the work of the team that has been assembled to really focus on supporting schools. And that has gone on since the beginning of the pandemic. And she will share more of the details of how that work has proceeded. School districts then work to take those directives, to take those guidances that come out of this collective process and set up the specific procedures for their schools. And so it truly is a collaboration in order to allow the schools to reopen safely. Next slide, please. And there is such strong citywide support to have this happen. It has been a priority from the beginning for Mayor Breed and her reopening plan. We have laid out the minimum health and safety standards that should be met in order to reopen schools. And again, our interest is in the safety of students, their families, teachers, and staff, everyone who is involved in our schools. And the criteria for reopening is really linked to having low levels of community transmission. As we said, it is tied in part to our state's tiered system in the blueprint for a safer economy. And at the orange level, schools TK through 12th grade are able to open. The things that are building into that tier that tells us how we are doing in terms of COVID-19 are how many cases, how many people are being diagnosed with COVID-19, how many people are in our hospitals in San Francisco with COVID-19, and how many people who get tests end up being positive. The lower all of those numbers are, the better. And at this point, we are much lower than we were in the winter at the height of our surge for COVID-19. So we're in much better shape, and therefore it is a much more safe environment for students and teachers and staff to all be back in school. And again, our schools team, along with our team that includes the health officer and the city attorney's office, have really been supporting schools to safely reopen, and have done that successfully, including with private and parochial schools, childcare, summer camps, the community hubs, of course, and out of school time programs and higher education. So at this point, we know that we can do this safely, and we have a lot of experience right here in San Francisco that says that it can be done. Next slide, please. And why is this so important? Why are we so committed as a city? Why are we so committed as a Department of Public Health? And why do I personally feel that it is so important? Well, we know that vaccines for children and youth under 16 are not approved yet, and they are still months away. We have heard good news about results from vaccine trials in youth who are 12 to 15 years of age. So that will likely, we'll hear more about that in the coming months. But for children who are 11 years and younger, it may not
Và
be
dĩ nhiên là cho với tất cả
first
những em
part
học sinh
of
nào mà
January.
dưới 11 tuổi.
We know that education inequities are one of the
Và
root
chúng tôi
causes
biết rằng là
of health inequities.
với tất cả những cái hoạt
And
động đó,
research has showed us that when schools comply with measures, there is
khi
minimal
mà
spread of
chúng ta đã thấy rằng
COVID-19.
là khi mà tất cả những
And
các em học sinh
this
nó
is
có
not
thể
just
theo được tất cả những
research,
cái vấn
this
đề đó
is
như thế nào.
real world experience from other states that have done
Và
this
dĩ nhiên rằng là chúng
successfully,
ta đã có thấy được rằng là
from our schools that have already opened in San Francisco.
và đối với tất
There
cả
have been
những cái
articles about this in some of the top medical journals in the United States that you see listed here. We also know that very sadly, there have been mental health crises increasingly documented in students, especially teenagers, with the lack of in-person education in schools. And this unfortunately has pushed some areas to move towards school reopening because of the crisis in mental health. We also know from our colleagues that work in emergency rooms and work as pediatricians, that San Francisco has not been spared from this. And I know that for all of us, it's been a difficult year, and especially so for children. In addition, parents and caregivers of school children have not been able, in many cases, to return to work in person until the schools reopen. And that also is critically important to be able to earn a livelihood and maintain health and stability for families. And the city may need to continue community hubs, or families often may need to pay for childcare, which is a challenge. Next slide, please. So for all of these reasons, and because increasingly we understand how we can reopen schools safely and have done so, I released this statement, and we did this as a Department of Public Health, but I wanted to strongly say that it is important that we move towards reopening schools, that we can do this safely, and that it is critically important for our city to do this, for the health of our students, for families, and for staff and for teachers and administrators, all of whom we want to stay healthy and safe. That is my job as acting health officer, to keep this city safe. I don't have an individual patient. My patient is the entire city. And I see that reopening schools is what is needed to maintain the overall social health, mental health, overall well-being of our students and our families. So with that, I will turn it over to my colleague, Anna, who has done tremendous work leading the teams that have worked day in and day out to support schools reopening. And then I'm happy to stand by to answer any of the questions you may have. And again, I want to sincerely thank you for everything that you are doing, all the sacrifices that you have made. San Francisco is much better off than many other cities in terms of COVID-19, in large part because of the actions all of you have taken. And we are committed to returning that effort and that sacrifice by helping you and helping families return to school safely. Thank you so much.
Thank you, Susan. So to give everyone an overview of the application process for school reopening, I am the team lead for the Schools and Child Care Hub, and we have three main functions. And the first one that you see here in the purple box is that we receive and review all of the school reopening applications in the city, which requires three parts. There is an actual written application that we have a clinician review. We have each school site submit information on their building. That includes how they're going to clean the building, the ventilation inside of the building, and all of the information about water systems to make sure it is safe. And we have our experts review that as well. And then we have a site team, we have a team of people that go to each site and do a site assessment of the school to make sure that it is in compliance with all of our prevention measures before it opens. And we also monitor any complaints of schools after it opens and respond to those complaints to make sure that the school stays in compliance with all of the measures that we have outlined. Secondly, we support the community by participating in town halls such as this. We also address a lot of the community concerns, particularly all of our childcare sites, our schools, our colleges, and make sure that it is incorporated as much as we can in our directives and guidance so that they can use it the most effectively as possible. We receive and respond to many questions from the community, including families and our partners that are in childcare and schools, whether it is by email or over by the phone. And then we organize and participate in webinars and town halls. And to reiterate, this town hall is on schools. We will be hosting a town hall on youth sports later this month to address the many questions that we are getting on sports for our children. And then lastly, we have a team of people that respond to any possible exposures or cases in any of these sites that we are assisting during this pandemic. That includes childcare, schools, out-of-school time programs, and colleges. And then we work to coordinate and investigate all of those test results and make sure that we report that in the most accurate way possible. As Susan had mentioned, our team works on school's directive and guidance, and this outlines all of the safety precautions that our schools need to apply in their sites in order to make sure it is as safe as possible. So, and we have to use the information from the state, both the state health department and Cal OSHA, in requiring the school opening plans. So for school-specific measures, they are daily symptom screenings for our students and staff, establishing small, stable cohorts at the staff, at the school that will limit mixing, making sure all of the entrances, the exits, and the movement within the school is done as safely as possible. Conducting screening testing for staff depending on the color tier that our county is in, creating options for distance learning, especially for students that may have some underlying health conditions and want to stay home, and requiring that the school have some communication plans, especially in the event if there is an exposure or a case. So those are some school-specific measures, and then there are some universal measures that apply to anywhere we go in San Francisco. That includes face coverings, physical distancing, making sure we have healthy hygiene practices, that we're washing our hands or using hand sanitizer, that we're cleaning our facilities on a regular basis, that we are testing people if they are experiencing symptoms or if they're considered a close contact, and of course, doing case identification and contact tracing. We have had a number of schools open since the fall, and you can see here from this graph that we have had approximately 19,000 people, including students and staff, attending in-school person. And we have been monitoring the data from those sites. You can see here that of all of those sites, of 19,000 plus people, there have been 108 cases that have been confirmed. And of those cases, there have been less than 5 that have been spread within a school. And I need to repeat that. There are 108 cases, but less than 5 have been spread within a school. I can't even share the number of cases with you because it will violate our privacy threshold number. We can't release numbers that are less than 5. That's how small this is. So this shows that schools that are complying with our measures are safe to attend as much as possible. And it is the same for outbreaks. We have 105 sites that are open, and we have less than 5 school outbreaks. And again, I cannot share the number because it is that small and it may violate the privacy threshold, but it is demonstrating that it is a relatively safe environment as long as schools and those that are within the schools comply with all of the prevention and mitigation measures. And lastly, we have been working very closely with the school district on all of its applications. We have received 79 letters of interest from the school district, and which has started our review process. We have gotten 62 applications. We have been going out to, we have completed 58 visits to these schools, and we have approved 55 of the schools for reopening. All of the schools scheduled for opening on April 12th have now been approved by the health department, and we are more than halfway through the list of schools that are scheduled for reopening on April 19th, and fully expect to be on track to complete that review in time for reopening. And lastly, we wanted to address issues related to childcare and out of school time and sports. We also published directives and guidance related to that. So clarifying that children and youth can be in 2 additional programs outside of school. So a child can attend school, and they can attend a community hub, and they can attend one other program. That is an example. This includes all of our outdoor programs, all of our community hubs, and most other extracurricular activities. The only restriction is if a child or a youth is playing an indoor moderate or high contact sport, then that is the only out of school time program that they can participate in. And this is due to the fact that playing indoor sports is a relatively riskier activity than in-person learning, and we want to make sure that we do this as safely as possible. When we moved into the orange tier, this was the first time we offered indoor sports, and we are carefully evaluating this as we slowly reopen these programs. Maria Sue can speak to this more, but there will be no students that will lose their space in a community hubs if they return to in-person learning at the school district. And again, highlighting that we will be hosting a separate town hall on sports later this month. And that is the end of our slideshow.
Great. Thanks, Dr. Phillip and Anna. One of the other big topics of this evening is about before and after school options for families and caregivers. I want to turn to Mele from the school district. Mele, we've been hearing a lot of questions from parents about what kinds of before and after care options there are that are outside of in-person instructional hours. Families are needing clarity about whether or not there will be the standard on-site partners this spring when students begin returning to district classrooms, and also questions around pickup and timing. Most families, or many families, do not have the flexibility to pick up their child in the middle of the day. What are the options for those families who need care after in-person school day ends?
Yep. Thank you for the questions. And I'm sorry because I don't have easy answers or answers that people are looking for. I think that's the challenge of opening schools in a pandemic, when what we call standard is not standard anymore. So as the Department of Public Health folks described, there are a lot of health and safety protocols that we have to follow, both from the California Department of Public Health, the San Francisco Department of Public Health, and we also have agreements with our labor partners on how we implement those guidelines. And with all of that combined, the work that it takes and the lack of physical space that we have in our school sites, we are not able to provide after school after the instructional day. We recognize that that is challenging for families and difficult. Yes, I'll try to slow down, sorry. It's difficult, and we looked in many different ways of how to be able to provide those services, and we are not going to be able to provide those through the end of this school year. Many schools have what we are calling early release on Wednesdays, and we are working with our community-based organization partners to see if on those Wednesdays, on those early release days, we can provide aftercare for a short amount of time. Not every school will be able to provide that because our community-based organizations also have staffing challenges, and some of them are unable to do it because they don't have enough staff to hire to be able to provide that service. I'm seeing another question. Did you want me just to read that, or sorry?
No, go ahead.
Oh, okay. So that is the information that I can give you today about after school and before school, sorry.
Thanks, Millie. From the city side, Maria, some questions around what kinds of opportunities the city is providing for care and what the city capacity through community-based organizations is like. Questions that Anna referred to earlier about how community learning hubs will function once schools begin opening. And if you have additional information about summer planning or summer plans.
Thank you for the questions. So just very quickly, DCYF in partnership with the Rec and Park Department, as well as our San Francisco Public Libraries, and of course our nonprofit agencies, have created our Community Hubs initiative. And that's these place-based strategies where families who are high-need families who fall into our priority population have access to in-person supports. That's usually delivered by nonprofit agencies, and in some cases delivered by Rec and Park staff. Unfortunately, all of our CBOs have been pulled to come in to provide supports at these hubs. And as a result, our CBOs are not running separate after school or out of school time programs in the community. For summer, we are standing up the Summer Together initiative, which is a coalition of city departments, including Rec and Park, as well as our school district, as well as nonprofit agencies and private camps. And this initiative is to support our public school families to take the time during summer to recoup a lot of that learning loss that has happened during the school year, and to allow children who have been stuck inside to have an opportunity to be with their friends and peers and to engage with caring adults. My goal is for this initiative to allow families to create some level of normal for their children so that children can start acting and behaving in kind of slight school settings where they wake up in the morning, they go to a camp, they go to a program, and they get into that habit so that when school starts in the fall, they'll be ready. We are going to prioritize enrollment for this initiative to our high need populations first. So we actually will be releasing more information on our website at summertogether.org in another week, actually next week, where families will learn more about the priority population and then learn about when the dates for enrollments will happen. And I can tell you now, enrollments will happen in April. We're landing, I think, on April 19th for priority population. And then for general enrollment will be May 8th. I think that's it from me for now.
Great. Thanks, Maria. We're going to spend the remainder of our time together answering questions that were pre-submitted from folks that pre-registered, from town halls with Board Commissioner Lopez, and that we are currently receiving live tonight on Zoom and through Facebook and YouTube. We're not going to be able to get through all of these questions. I think right now we have about 250 questions, but we hope to still get you the answers over the next week and post them in FAQs through various department web pages. I'm going to start a question to Mele with SFUSD. What transportation options are available for returning students, especially since we know public transit has reduced capacity?
For transportation options continue for students with individual educational learning plans, if it's part of their IEP. We are not providing general transportation. We are not able to resource-wise, but we are providing that. We have worked with SFMTA in providing more buses. But again, we've been able to provide transportation to our students with special needs, but we don't have any other options for other folks. I know according to SFMTA, and nobody from there is here tonight, so those really are people who could better answer this question, that they are trying to increase lines and provide more services. Crossing guards will be out at schools as they were pre-pandemic to help with navigating, for traffic control and support for families and students dropping off or coming from public transportation.
Thank you, Melly. For our next question, we received a few questions from families about whether students will need to take COVID tests and also about whether they will need to be vaccinated. So a question, I believe, for Dr. Phillip. We also received questions asking if students and their parents are being encouraged or helped to be vaccinated and whether vaccinations can be delivered at school sites where trust may be higher.
Thank you. Yes, it's such an important question. Students will not be required to be vaccinated to return to the classroom. As I mentioned, students who are younger than age 16 are not able to be vaccinated at this time, but we think that the vaccinations will be allowed for them as the FDA gives them emergency use authorization for children in the coming months. Soonest for the students aged 12 to 15, and then for those who are 11 and younger, it likely will be in January of the next year. And in terms of testing, students are not going to be required in the current orange tier to have regular testing in order to return. I want to also emphasize that we know that even without vaccination of students, even without testing of students, we are able to bring students back safely because we have done that right here in San Francisco for many, many students for many months. And we know that that has happened across the United States as well.
Thank you, Dr. Phillip. Mele, I see that you have your hand up.
Yes, thank you. I wanted to speak a little bit to the testing. So as you recall, I mentioned that we follow the California Department of Health, San Francisco Department of Health, and the agreements with our labor partners. In our agreement with our labor partners, we are required to provide testing to students, to 20% of our students when we are in the orange tier, which is when we are. However, no student will not be able to access in-person learning if they choose not to be tested, but we are providing that service because it is part of our agreement with our labor partners. So families will be getting information about where they can go if they choose to have their student tested. We will have 4 testing sites throughout the city, and then students will also have the opportunity to be tested at their school on a rotating basis.
Thanks, Mele. A question from one of our Zoom participants. I think, Anna, you might be able to respond to this. Early education sites are not part of the school reopening dashboard from the city because they don't apply for reopening. Why isn't there a tracker or dashboard for district early ed sites? We need transparency. A TK inside an elementary school isn't that different from that at an early ed site. I've been asking for this to be fixed since March and no response at all. Anna?
Thank you for that question. We do provide directive and guidance for childcare for ages 0 to 5 years old. And the early education sites fall within that guidance for childcare. And we do not have an application process that we apply for any childcare site in the city. It is that we just provide the directive and the guidance, and we work with the site to implement that, but we do not provide any site assessments or an application process. And that has been across the board citywide, and that is how it's being conducted in with the school district as well. And we do understand that that is does appear to be a double standard, but that is how it's been applied throughout the entire city. However, we have been working with the school district regularly for months now and have been providing that expertise and that guidance to make sure that the early education sites are as safe as possible for return. So thank you.
Thank you, Anna. For our next question, I believe this will be directed at Dr. Phillip as well. Will it be possible to do high school graduations outdoors, socially distanced, and with immediate family members? Can you speak more on graduations?
We know, and I know that it's been such a difficult year, and for the seniors that are graduating, they want nothing more than to be able to gather safely with their classmates and their friends and their family. So we are working now on a plan to be able to do that safely. As we've learned during this pandemic, being outdoors is safer than being indoors, and staying masked is also an added layer of safety. So we are going to be rolling out and talking more about plans to allow in-person graduation with distancing outdoors and with masking. So you will hear more about that in the coming days and weeks.
Thank you. Dr. Phillip, I think this is another question for you and also Anna as well. We've received several questions about COVID variants and whether there should be concern about those as cases increase across the country and we are reopening schools. What can you share about this? And if San Francisco moves into another wave of virus cases, would the schools close?
This is a really important question about variants, and particular B117, which has sometimes been called the UK variant because that is where it was first detected. First of all, in San Francisco, we are fortunate to have great scientific, academic, and laboratory partners at UCSF and at the Chan Zuckerberg BioHub lab, who are doing sequencing of some of our positive test specimens. And what we have seen in San Francisco is that B117 levels here that are detected when we do specialized testing are very, very low. It's quite different than what is being reported in Michigan and in other parts of the country. So we are in a different situation here, but we are aware of the challenges of B117. And in many cases in the Midwest, it has been linked to youth sports and particularly very close contact indoor sports. And so we are taking that into consideration as we think about what we can do to minimize the risk of transmission in children. And our primary goal is to keep in-person learning available and to keep cases low. We also feel very reassured that although we have a ways to go, San Francisco overall, among those who are 16 and up, is doing a great job relative to the rest of the state and relative to the country as a whole in getting people vaccinated. And we have just crossed the threshold and the governor's announced who is 16 and up is eligible for vaccine. So it's really important that for all of us, once we are eligible, please get vaccinated. These vaccines are protective against B117, and we believe are protective against any of the viruses that we might encounter here in San Francisco. And that is what will allow us to keep our case rates down and keep students in classrooms, in camps, in their sports programs safely. And then as vaccines are available to children, we will want them to receive vaccine as well. Thank you.
Thank you, Dr. Phillip. The next question is Al and maybe partially Melee. We're getting a lot of questions about why the school district rules around reopening, spacing in classrooms, and other protocols aren't lined up with the DPH guidance. Can you talk about how the decisions are made, who is involved, and how does this related to the agreement with labor partners and building preparation?
Thank you. I'm going to assume that this is really related to the 3-foot distance to be able to return to school safely, while we have generally 6-foot guidance for adults and most other people in other settings. The reason for this is the science that has been building over time during this pandemic, and it is very specific to children. And the reason for that is that we have seen that this virus, the SARS-CoV-2 virus that causes COVID-19, has less likelihood. It is less transmittable. Children are less likely to acquire and transmit this virus. And we've also seen from school districts throughout the country that have documented, and CDC has documented their experience with being able to reopen for in-person instruction at a distance of less than 6 feet, as narrow as 3 feet, that they have been able to do that safely. So it is very specific to children, and it is different than for adults. So that is the scientific thinking that has gone into it, and that is the reason why it differs. So thank you for the opportunity to explain that. I know that it can seem confusing and arbitrary, but again, in San Francisco, as we've heard Dr. Colfax, the director of health, say many times, and I believe it as well, we have to follow the science and the data and the facts. And at this point in the pandemic, with all the experience that we have behind us and that we can look at throughout the world, for children, that 3-foot distance does correlate with a safer way to operate, allowing children to be at that distance for learning in particular. So that's the answer that I would provide. Thank you.
Thank you, Dr. Phillip. And I'm school district's perspective.
Sure, thank you for the question. So thank you, Dr. Phillips, for describing. So the guidelines that come from CDC are recommendations, and then the state can choose whether or not they want to incorporate them into the guidelines. And then the Department of Public Health also determines what is going to be added into their guidelines. So then what happens for the school district is we have our labor partners that we work with, and we are committed to always meeting with them to what we call bargaining the impacts of the agreements. And around health and safety protocols, we bargain the impacts of the health and safety guidelines and what that means for coming back to school. So when we work with our labor partners, we come to agreements which sometimes are the same as the health and safety guidelines and sometimes go beyond, depending what we have negotiated. So with respect to the distance, we started our negotiations with our labor partners in January, and when the 6-foot distance was in that place, and we made agreements around that. And then the guidance changes as the pandemic changes. And oftentimes, sometimes with our agreements, we will change with the guidance. And sometimes with our agreements, we will stay with the agreements that we had previously. So with respect to distance, we are striving to keep student desks at least 6 feet apart, but we will go down to 4 feet. And there are other safety factors we will bring into it. And then I think that that's the distance between students. The distance between a student and an adult will always be 6 feet.
Thanks, Millie. We have a lot of questions from community-based organizations who are anxious to rehire staff and begin working with students again. What safety protocols do they need to be following to begin offering their programming again? Should they begin contacting schools they have worked with and funders who support their programs so they can start up? Do we know when they might be able to get back to work? Maria?
Thank you for that question. I think I will start, but then I will kick it over to Melly regarding school access to schools, and then to Anna regarding health safety and health protocols. In terms of nonprofit agencies who's interested in opening up their after-school programs or their community-based programs, we, DCYF, are willing and want to have conversations with you. For this particular year, we are looking to expand our summer programming and summer offerings. So if you have a summer program, please contact us. You can reach us on our website, dcyf.org. And then in terms of safety protocols, I want to remind everyone, as what Dr. Phillips shared, DCYF have been funding in-person community hubs for several months now, for almost a full year. And because our nonprofit agencies have followed the that the Department of Public Health asked us to, we have not experienced a major outbreak in our hubs. And that's primarily around masking. So having children wear their mask when they are in the space has helped us achieve that really fantastic low infection rate and 0 outbreaks. But I will ask Melly or Anna to help build out on that question regarding access. And
so I can talk a little bit about access to schools. So currently we're 100 primarily focused on getting our schools and preparing them for in-person learning for the next 6 weeks at our elementary, middle, and high schools, and also providing athletics at our high schools using our facilities. So given all of the work to get our schools ready to open in person, we are not going to be providing spaces for community-based organizations during the next 6 weeks. We are having conversations with DCYF about what does the summer look like and how can we start opening up our schools, because we know that it's super important to have our community-based organizations back in our schools, providing services to our students. But for the next 6 weeks, aside from the very small group of organizations who may be supporting us for lunch, recess, and that 1 day of aftercare, we will not be opening up schools for other community-based organizations.
And then lastly, I can talk a little bit to the safety protocols related to all of these programs. And we will make this available to the PTA for their website. But there is a guidance that is, we call it out of school time guidance. It is for all programs that are functioning not at the hours that school is not. And that includes all of the learning hubs that are supporting distance learning and also any summer programming. So we have our guidance that will establish protocols to let these programs run as safely as possible. And all of those community-based providers should be following the out of school time directive and guidance as they move forward with their plans for implementation. Thank you.
Thank you, Anna, and thank you to all of our panelists, and of course to all of you who participated tonight. Unfortunately, we couldn't get to all of your questions live, But we do want to, Hayan will let you know afterwards how we will get the information to you. So I want to thank our Department of Public Health, Department of Children, Youth, and Their Families, Parents for Public Schools, the 2nd District PTA, Mission Graduates, and the Mission Economic Development Agency. And of course, there's a whole team of people behind the scenes that help to make tonight run smoothly. So to each of you, thank you so much. Now I'll turn it over to Hayden.
Thanks, Katie. It has been an extremely challenging year, and there are so many more questions than we certainly had time to answer today. All of us here want to thank you for those questions. They help guide our work. We have been talking about holding more town halls about summer programs and sports. So please stay tuned. Continue to let us know what information you need to support your children and families. You'll be able to find a recording of this webinar on the SFGovTV Facebook page and YouTube channel, and also have information posted at the 2nd District PTA website, as well as the Parents for Public Schools of San Francisco website. Thank you again for being here tonight. Stay safe, stay healthy. Good night.